going to look at a topic that is quite trending. We know that with the coming of COVID-19, there were containment measures. Most of it has to do with lockdowns. The word lockdown has become a new word in our vocabulary. But today we are going to look at it from a different perspective. We are going to look at relaxing the COVID-19 lockdown, which we know it's happening in different parts of the world. Here, right in the United States, there are agitations to lift the lockdown. So we are going to look at relaxing the COVID-19 lockdown with special emphasis on Nigeria. And we are going to zero down on how to manage the healthcare and the socioeconomic implications. Let me give you a status report on COVID-19 in Nigeria as of today, 12 noon, May 3, 2020. The stats are showing 2388/351/85. What that means, the number of cases total 2,388. The number of discharged patients, 351, and unfortunately the number of deaths, 85. What that tells us is that 15% of the cases have been discharged, and 3.5% were recorded deaths. This is kind of a little bit worrisome because Nigeria used to be between 2.5, 2.75%. Within the last 1 week, we've gone up to 3.5% deaths. However, there is a proposed gradual easing of the COVID-19 lockdown in Nigeria. But however, this is bringing a lot of worries in some areas, some relief in certain areas. But let's just look at the issues from the healthcare perspective and from the socioeconomic concerns. So with us today, we have very distinguished personalities who are going to look at these issues from several dimensions. But a big question that we need to ask as we look at these issues is this: how do we conduct ourselves under the relaxed lockdown without losing the gains of the lockdowns? Already we've made some gains with the lockdowns. Now we are going to relax the lockdowns. People can move a little bit. People have to wear face masks. The markets are going to be open for some number of days, and a whole lot of stuff is going to happen. But the big question is this: how do we need to conduct ourselves so that we do not get into a second and a third wave of the pandemic, which history has shown is usually more devastating than the first? So with us here today to discuss these issues, we have Dr. Akilah Jefferson Shah, who is an allergist and immunologist from the University of California in San Diego. She's also with the Rady Children's Hospital in San Diego, USA. Dr. Jefferson, we welcome you. We have Honorable Olamide Davies-Talabi, the CEO of Imperial Group of Companies, LLC, Newark, New Jersey. She is also an honorable member of the Office of the Mayor of Newark, New Jersey. She's also joining us. We have 3 other contributors online. Dr. Kolapo Akinyemi, who is a medical practitioner in Abuja, Nigeria, and Dr. Philip Ode, who is a climate change and sustainable development. Maurice Atoke, who can be the Coalition on Health in Nigeria. And I am your host, Dr. Paul Abolo, the President of Ecologistics Integrated Services. Now, without wasting much time, we would like to hear from Dr. Jefferson. Let's get your perspective on how we need to conduct and manage ourselves in a situation where the lockdown is being relaxed. Dr. Jefferson.
Thank you, Dr. Abolo. Thank you for having me today. I want to give a brief overview of COVID-19 and SARS-CoV-2, which is the virus that causes COVID-19. And what we've been doing here in the United States, as far as criteria for considering relaxing lockdowns and for reopening the economy. So, there are really 4 different aspects to this. The first is looking at transmission of the virus. The second is testing capabilities, including types of testing that we use. The third is contact tracing and isopacity. So with transmission, COVID-19 we know is transmitted via respiratory droplets. We know that these droplets can travel up to about 6 feet between individuals, meaning if you're closer than 6 feet to someone, there's a they're infected, there's a possibility that you could yourself become infected, which is why we do things like physical distancing and social distancing to decrease that transmissibility of the virus. It then goes into things like touching surfaces or avoiding surfaces, washing your hands, things like that, and then masks, of course, to protect yourself and others. But really the big thing with COVID-19 is the infective ability of the virus. And when I say that, I mean the effective reproduction number. So if I get infected or you get infected, how many other people will then become infected if they come in contact with me? We think that the virus has a effective reproduction number of about somewhere between 2 and 4, meaning that any individual, if they're infected, will then pass it on to somewhere between 2 and 4 other people. If you compare this to something like influenza, which has an effective reproduction number of about 1.4 to 1.7, meaning you'll pass it on to about 1 to 2 people if you're infected. So it's much more, the SARS-CoV-2 virus is much more transmissible, and it's much more infective than other viruses. When we think about trying to ease isolation and ease quarantining people and kind of pulling back on social distancing, this effective reproduction number is very important because we need to make sure that if people come in contact with one another, again, that they're not able to easily transmit the virus to each other. So there are a few ways to do this. One is if a certain number of the population becomes immune, either via vaccines, which we currently don't have, or individual infection, then we know that we can kind of slow the transmissibility of the virus. This depends on a few different things, such as density of the population, behaviors of different individuals, social distancing, and then the rate of disappearance of cases, which either is through individual immunity, vaccination, or unfortunately, after people pass away from the virus. This then gets into issues of things like herd immunity. When you want to have a certain percentage of the population that's immune, usually an effective percentage is somewhere between 60 and 90% of the population immune to the virus to then confer herd immunity. Some countries are using this approach. The United States is not one of those countries. In Sweden, for instance, they're trying to just do herd immunity, which means letting people get infected and then seeing kind of where the virus goes. That's a very tricky approach, and it increases the amount of deaths that could have been prevented, which is why we're not doing it here in the US, and most other countries are not doing that. But we do know that we need to have at least somewhere between 60 and 90% of the population who has some sort of immunity, so that we don't get these second and third waves as time goes on. If we go ahead from there, we can get into things like testing. So how do we know which percentage of the population is immune? We know from the numbers that we have, such as what Dr. Abolo mentioned, the numbers that you have that are being taken by the government and in different hospitals of cases and of recoveries and things like that. But then we also need to have good testing situations in place so that we know who is actively infected and then also who has past infection or immunity. So that brings us to 2 different types of tests. There are molecular tests, which look for active infections. They're generally called PCR tests. And then there are serologic tests, which look for antibodies against the virus, which are looking at past infection and presumably immunity to the virus as time goes on. With these tests, we have to also worry about issues of false positives and false negatives, which decrease the accuracy of the testing. Um, every test that we have has a small amount of that. Antibody tests or serologic tests, and they seem to have pretty good, pretty low false positive rates, which is a very good thing, meaning that we can trust the test and the results that we're getting. Um, Here in the US, we've been trying to do different serologic tests in the community to act as a surrogate for the amount of people who are infected. So in New York, for instance, they randomly tested a population of people to see if we can figure out the incidence of, or the prevalence rather, of COVID-19 in the city. And it said that about 20% of people had antibodies against it, meaning about 20% of people are presumably immune to the virus. This is very different from the numbers that they have as far as cases that are known. The reason for this is because we know that COVID-19, there are people who have asymptomatic cases, and then also people have very mild infections that that don't really need to go to the hospital or anything. So we're missing those people. So here we need to make sure we have good serologic testing so that we can figure out how many people actually are immune, have antibodies against COVID-19. And then the other issue with the antibody testing is that we'll need to know if those antibodies that are being measured in the test are at high enough levels to be protective, and then also if they confer long-term immunity for a person, which means if a second wave or a third wave comes, that the person is still protected against COVID-19. That we don't have a good answer for as of yet. The data is still being gathered. The testing is still being done to figure out how long people will have immunity after they've been infected. The last part that I'm going to talk about briefly are the contact tracing and then also the treatment capacity. So for tracing and then isolation, we need to have systems in place where we know patients who have been infected via testing, right? And then we can then figure out who they've come in contact with and isolate those people so that we stop the spread of the virus. This can be done via individuals going out and contact tracing. This can also be done with technology using geolocation data from Bluetooth or GPS-enabled smart devices to assist so that we don't need so much manpower on the ground. That's something that we can do to decrease the number of in certain populations, certain cities and communities. The last thing there is also considering things like border restrictions and banning or limiting non-citizens, which I know is being done in many places, but continuing that so that we decrease the amount of people who are coming into the country with COVID-19, and then decreasing the transmissibility there. Last but not least, for treatment capacity, right now in the United States, there are no FDA-approved treatments for COVID-19. There are a few medications that have had accelerated limited use approval. One this week is called remdesivir, which is an antiviral. It seems to decrease the length of illness in studies and also decreases mortality, though that number was not significant. The other medication that is being used here pretty routinely is convalescent plasma, which is plasma that's taken from people who've recovered from COVID-19. It seems that it may also decrease the length of illness in a study in severe patients. So those are both good options right now, but still we have studies that are going on for other types of antivirals, other types of antibody-based treatments, which I believe will actually be the key to this here. And we have lots of clinical trials going on for those things across the United States and across the world to see what is going to be the best treatment possibility there. But in the absence of treatments right now that are approved, we have to make sure we have good hospital infrastructure, meaning good surge capacity if patients do get sick and if there is a second and third wave, that there is enough protective gear for patients and for providers, nurses, doctors, everyone else in the hospitals. But there are enough supportive cares like ventilators, dialysis machines, things like that. And then lastly, once we get a vaccine, which right now there are several trials going on across the world. In the United States, there are several that are in phase 1 and phase 2. We think somewhere between 6 months and 12 months, we should have a vaccine that is effective against COVID-19. So kind of in summary, the big things really are decreasing transmission as much as possible, and then having adequate testing in place that we know the prevalence in the population, and that we can then figure out if we're reaching that point of herd immunity or not, and adjusting plans based on that. Contact tracing and isolation, and then making sure there's capacity for treating patients if they do get ill. One last thing I want to mention, I'm sorry, about testing, is here we're starting to do something called wastewater testing, which is population-wide testing, where you can test wastewater in certain cities to see if the virus is detectable there. That's been shown in other outbreaks to find the virus earlier than patients actually present to medical care. And that can also curb the transmissibility of the virus if it should kind of have a resurgence after restrictions are lifted and people are not under quarantine as much anymore. So I'm going to stop there, Dr. Abolo.
Thank you very much, Dr. Jefferson. We have a lot of questions for you, but we're going to get to that after we have had all the presentations. You said something about decreasing the transmission, which happens to be the focal point for now. Am I correct? So with the lockdown, we are able to decrease the transmissions. When we begin to relax the lockdown, does that mean that we are also going to now allow the transmission to start increasing? So the question is, what do we do when we are relaxing the lockdowns so that we will continue to decrease the transmission? Now, from our perspective here in Nigeria, we understand that women as managers of homes, and they are the most predominant groups in the marketplaces. Our marketplaces here are crowded, like the malls in New Jersey are crowded too. Malls in New York are crowded, and predominantly in the marketplace in Nigeria we have women, and women are also the managers of the homes. And statistics have shown that we have more women in the healthcare system. Therefore, the position of women is quite critical in managing our conduct during the lockdown. We are going to have Honorable Talabi speak to us about how the women, including the men, of course, should be able to conduct themselves, conduct their homes, conduct their transactions in a way that will not compromise the gains that we've already made with the lockdowns. Honorable Talabi, can we hear from you?
Yes. Thank you, Dr. Abolo. As women, we have a big task ahead of us, especially Nigerian women. Tomorrow, as the government eased the lockdown, there's so many things that we need. A mask. This is one I have. Breaks. You can just make for yourselves and your families and make sure that everybody wears a mask when they're going out. And when you come back in, I go to the groceries once in 2 weeks. And when I come back, the first thing I do is I take everything out, my clothing, put everything in the washing machine, and I go to the bathroom to bath. The coronavirus doesn't like heat. That's something that everyone knows about. So make sure that you wash everything you're wearing. Make sure the kids wash their hands often. Make sure your husbands wash their hands often. And when you go to the marketplace or you go to the store, make sure that when you're there, you have social distancing. Nigeria is not practical in Nigeria. I'm gonna be frank with you, Dr. Abolo. But as citizens, you have to take your own health in your own hands. When people are rushing to get into that car, into that bus, give them some space, let them go. You don't have to rush, let them go. And if it's too crowded, don't go in the car. These are some little things that we need to take into consideration when we start tomorrow, because I can just see, I'm just keeping my fingers crossed, and hopefully we don't have a resurgence of the numbers in 10 days. This has been proven during the Spanish flu, and the way things are going, everyone is excited, people want to go out. Another thing is that if you do not have to go out, don't go out. Even though the government said, oh, let's start going out from Monday, it doesn't mean that if you don't have any business going out, you should just go out for the sake of going out. Stay in the house. You are the one that knows your immune system. You know how strong you can fight a disease. Don't compromise your health just because you want to go out. Stay home if you don't have to go out. And when you go out, make sure you wear mask, make sure you have social distancing, make sure when you come back home, you take off all your clothing, you take your showers, wash your hands. And the most important thing that I'm doing for my family is that we are boosting our immune system. I'm not a medical practitioner, but I've seen so much things on YouTube how to boost your immune system. We drink garlic, we have pineapple, we have onions, we have, what else we have? We have so many things that we blend together and we drink. And those things have been proven to improve your immune system. And because there's no cure for COVID-19 right now, so what can we do? We have to boost our immune system, drink garlic with hot water, anything hot, just keep drinking hot water, drink hot tea, and keep yourself safe, and make sure that when you go out, you have social distance, and make sure the kids wash their hands, and make sure education is very, very, very important. Make sure the kids wash their hands, and don't touch their eyes, don't touch their nose, don't touch their mouths. And those are just some of the things that as women, we have to make sure we keep, making sure our kids and our husband do. And sorry to say, men are mostly, they want to go, everybody wants to go out. I'm not going to put the men under the bus, but as women, we have to make sure that we keep the home safe. So as you go out tomorrow, those in Abuja and Lagos, they're the most hit with the coronavirus. Make sure that you have your social distance, and make sure that you wear your mask. And when you come back home, wash your hands. Thank you, Dr. Abolo.
Thank you very much, Honorable. While you're speaking, I was just imagining how children are out of school. So the mother needs to go to the market either to buy or to sell. So there's a critical issue there. The children are left at home. In most cases, maybe on their own supervised. And then the mother goes to the market, she's exposed in the marketplace. And one of the critical things you said is, when you get back home, wash your clothes. Which means that it's advisable to wash your clothes every day once you get back home. Number two, from what you said, it shows that there needs to be a proper structure at home when the mother is going out, because when the parents are not home, you find that the children have some level of liberty, and if they don't understand the impact of lockdowns, you could find them playing football, or find them straying to the parks and interacting with other children. So that's a critical issue we have to deal with there now. But I need to go back to something that you talked about, which dovetails into what Dr. Jefferson talked about. And the key word there is immunity. Dr. Jefferson said that there's another level of testing for people with antibodies. Am I correct, Dr. Jefferson?
Yeah.
But the issue is to know if the antibodies are high enough to sustain the person over a period of time. So the critical issue here now is this: how do we maintain a steady stream of antibodies? How do we test to know if we have enough, and what do we need to do to keep the antibodies at that level where we are adequately protected? Dr. Jefferson, can you throw a little bit more light on that from the medical perspective?
Yes.
In terms of maintaining or sustaining the level of your immunity?
Right. So with any infection, you're going to develop antibodies to that infection whenever you're exposed. Sometimes, so for instance, for the flu, it goes away relatively quickly within the year or so, and then you can get the flu again the next year, right? There are other ones such as measles, where usually if you get a vaccine to it, you become immune, or if you've had it in the past, you become immune, and you don't have to worry about it for most of your life. That's usually how it works. It really varies depending on what the virus or the bacteria is that you're talking about. With SARS-CoV-2, the interesting thing, or what makes it very kind of complicated, I would say, is that it's a new virus in humans. But the good thing is that it is very closely related to other coronaviruses that our bodies have seen in the past. That there is a thought that we will have pretty good immunity to those long term. So normal coronaviruses that cause just normal colds, most people have immunity for several years against that. And there's, it's just how it works. There's nothing that you have to do to sort of boost it. So the thought is that if SARS-CoV-2 and COVID-19 act the same way, which most likely it does, that we should have protection for years to come if you've been infected. A few things that complicate what I just said is, we know if you have a worse infection, you develop more antibodies to it. So if you get very sick, you're going to get more antibodies against it versus if you have a very mild infection. And we know that a large portion of the population has very mild infections where they don't really feel very, very sick. And so we're not sure if those people with very mild infections are going to get enough antibodies kind of going forward. There's honestly not a great way to boost your response to it. We really, long term, what we really, really need to boost it is a vaccine. That's the best way to do it. And we're still going to be waiting on that. So for now, I agree with everything else as far as washing hands, washing clothes. I even say wash your food from the market and everything like that when you come in. Washing your shoes, things like just disinfecting as many surfaces as possible to decrease the transmission of it. And then of course, like everyone is saying, wearing a mask to protect you and to protect others. There was some thought here that masks didn't really need to be worn by everyone in the family, just kind of older people or people who are considered to be more vulnerable. But I would say everyone should wear a mask, adults, children, mom, dad, grandmother, grandfather, everybody should wear a mask, because you don't want the children to then pass it on to the grandparents or anything like that, even if they don't get very sick. So that's sort of the antibody issue, the immunity issue. But overall, if SARS-CoV-2 acts like other coronaviruses, we presume that you're going to have long-term immunity to it if you do get sick.
Beautiful. That's quite comforting to know that there are possibilities that you might end up having a long-term immunity to it. In your presentation, you said something that's a little bit disturbing for me. When you said that there's testing going on for wastewater, the COVID survives in that environment. Can you throw a little bit more light on that?
Right. So wastewater monitoring has been used in other sorts of outbreaks over time in many places in the United States and in other places as well. What you can do there is, for instance, if we took a place like New York City and we tested the wastewater there for virus. So we would do what's called molecular tests. Coronavirus can be shed in that way through the waste. So if you test the water there, what tends to happen is that you'll see increases in the amount of virus before people actually start feeling population. You can that community. So the molecular testing, it is very, it's not done a lot in many places, but it's been done for a long time in a lot of places. And really what you would do is, if you have a city that you're worried about and you want to ease restrictions there, if you start testing the wastewater there, as you're easing restrictions, and if you notice an uptick in the virus in the wastewater, then you need to pull back again and start doing testing, other types of testing of the population and monitoring to see, to make sure people are not getting sick and transmitting it amongst themselves, amongst the community. So it's a good way to kind of stop the infection earlier than just waiting for people to get sick and show up to the hospital.
Beautiful. Thank you so much. Honorable Talabi, I also need to touch on a few things you talked about. You gave some very practical examples about people rushing to fit into a vehicle with mass transportation and the minibuses and other forms of transportation. With such transportations, you cannot maintain the physical distancing that is recommended. You might as well be able to have your mask, but I find it difficult to imagine where, under normal circumstances, the transportation is not enough. And now you want to create some physical distancing with the already limited number of Honorable Talabi, did you get my question? Hello, Honorable.
You were cut off.
Yes, I was cut off. Okay. What I'm asking is that during your presentation, you talked about, you gave a practical example of how people rush in to catch public transportation.
Mm-hmm.
And we recommended that in the process, they need to maintain some level of physical distancing.
Mm-hmm.
I live here in Abuja, and I see things. I see Beggar Junction. I see people lining up for hours, waiting for transportation, and the transportation is not even enough. There's an instinct, a natural instinct for people to want to rush to get onto the available transportation. The last thing in their mind is to think about physical distancing.
Coronavirus.
Coronavirus. I don't have the answers. I'm looking for the answers. That's why we're on this platform. How do we manage such a circumstance? Because I've been thinking about strategic ways of doing things, creative ways of doing things now. We have the traditional markets. Should we divide the market into segments where today the people who are selling meat and vegetables will be around, or tomorrow those who are selling. I don't know how to do it, because getting to the market to buy and to sell is a challenge. And there's the supply chain, there's the transportation issue there. And with the level of the transportation infrastructure that we have, it's difficult to maintain physical distancing.
All right, so Dr. Yeah, I know it's difficult. Like you said, it's difficult. But you know, at the end of the day, you have to think about your health first. You know, there's some decisions that are very painful, but you just have to do it. And this is where the government also can help. You know, there's some laws and some things that needs to be done. And if it's coming from the government's perspective, people will listen. You know, if the government can ask that the drivers don't have more than 10, 12 people in a car at a certain time, people will listen. If there's an action that can be written, like a law that can go out tomorrow saying you shouldn't have more than 10, 12 people at a time. And, you know, everything is about structuring. It's going to be difficult, but these are some things that we can still do. So I will say the state governors should put a law in place whereby people, you know, we have a certain amount of, let me say 12 people in a car at the same time, no more than that. And people should also look at the pros and the cons of everybody being in a car at the same time. You know, the risk. And if you find yourself in a situation whereby there's no other option, make sure you wear a mask. Make sure you wear a mask. And, you know, if you need to cough, do your end like this. And when you get home, like I said before, make sure you take everything out, you know, take a shower, drink everything that you need to drink to boost your immune system. There's no other way around it. You have to be responsible for your own health. And in terms of the marketplace, that's going to be a big challenge. But like you said, if there's a way we can structure things that everyone don't go at the same time. You know, if everybody don't go at the same time, and we have a certain number of people going at one time. I've been to this market in Ibadan. I can't remember the name of my head. And they have they have a gate where people go in. So this is a time to use that. So everybody can go in, but they can have a time that, okay, these people, maybe 100 people go at one time. Then when they're done, you know, another set of people go at another time. Instead of just opening the whole market to like thousands and probably millions of people going at the same time, there's not going to be social distancing, and there's a lot of risk in there. So if there's a structure that can be put in place by the Allergists and the Babalogists to make sure that the number of people going in at this time to do their shopping is regulated, I think that will help us a lot.
I think I got something from this discussion. Something just dropped in my mind right now, with you talking about structures. We could create dedicated entrances to the marketplace. So for the going to the marketplace, we need to make sure that they have the mask, and then we can do a kind of population control in the market, and we don't allow people to get into the market until we know that a certain number is out of the market. So we could have an entrance gate and have an exit gate. And if we look at the population in the market, this market has a normal population of, say, 100, and the recommendation now is to operate at 25%. So we can say the capacity that this market can take under the relaxed COVID-19 lockdown will be 25%, 25 people. So we have an entrance. At that entrance, we'll make sure that people sanitize their hands. We'll make sure that we check their temperatures, and they go into the market. Then when they leave the market, we need know the number of those leaving the market. and then we allow the number of those to enter the market. So we can maintain a kind of population control within the market. And that's another structure. I also thought of something when you were talking, you talked about making laws, policy, and also enforcement. So at the motor parks, at the bus stops, we need to make sure that we reinforce what we have there. The FIRS, not the FIRS, what do they call them? The transport people, I remember their name now. They need to be trained to know how to manage that. And then I'll recommend something else. At the motor parks and the bus stops, we need to put very visible signs showing the impact of COVID-19, telling people about physical distances as a reminder that, look, when you are rushing to enter the vehicle, seeing that sign will remind you that, look, you are at risk if you do not wear your mask. You're at risk if you enter the vehicle and you start talking. That's not the time to talk. You are at risk when you enter a vehicle that's overcrowded. I think that might help to some extent. What do you think, Honorable?
Very, very well, very well. You know, at the end of the day, education, and more education is very, very, is the key to this whole, reducing the COVID-19. I was on a blog yesterday, and some Nigerians still don't believe the COVID-19 is real. Even with the death rate and everything going on, they still don't believe there's COVID-19 in Nigeria. You know, they're going about with this theory that, maybe the government wants to make some money, maybe they, it's just some people still don't believe it. So if we have those, like you said, the banners, we have the signs saying, this is real. And people are dying, and you have to protect yourselves and your family. I think that will go a long way to, to give more people the awareness that they need to know that this is actually going on.
Talking about this, I want to share my experience a few days ago with you. We're going to take questions shortly. I don't know if Maurice is online. Is Maurice there? Is Dr. Phil there? Dr. Kalaway? Anyway, let's go on. And I met these young people, and they were celebrating, and they said, COVID will get power again. That means that COVID has lost its power. COVID has gone. COVID has gone. By Monday, we are all free. COVID has gone. And they were celebrating. And I said, COVID has gone. They said, yes, we had it on the news. There's no more COVID. COVID has gone. We defeated COVID. And I was quite worried because these are youths, these are young people. Okay, maybe not quite learned, but I thought they would have known better. So you can imagine that kind of feeling and that kind of behavior. It's quite reckless. Starting Monday. So one of the things I need us to look at in this process is to educate our people and let our people know that relaxing the lockdown does not really mean removing the lockdown. Relaxing the lockdown does not mean that COVID-19 has gone, like the young people we are celebrating. And on the part of the government, I think that this is the time to be more stringent with the laws that govern relaxing the lockdown. COVID-19 comes with a lot of challenges, but on the same time, COVID-19 has actually created what people now call the new normal. And a couple of people said that, well, the new normal is abnormal. So, but one thing that the COVID-19 has done, it had something we call cycle, CIRCLE. We developed this in our organization, and we said that COVID-19 has brought out the creativity in man. That's the C there is for the creativity. COVID-19 has enabled us to be here in Nigeria and we are talking to you in New Jersey and you in California. The technology has always been there, but we have never used technology as much as we are using now. From a climate change perspective, what has done for us. For the C, for the I, is that COVID-19 has increased our imagination. On the good side, on the bad side, people can now imagine, people can now think. I think there is a question here popping up about the 5G and the rest of it. I don't know if Dr. Jefferson will be able to answer that when we come to questions and answers. But people are able to now exercise their minds to imagine. And then for the R, the CIR, the R has to do with resourcefulness. People are becoming more resourceful. You see people now making masks. You see what's happening in Cross River State. Last program, we talked about Cross River State, how they are using this to create jobs and make money. COVID-19 has created something that is called the business of COVID-19, which is an entirely new business. We're going to discuss that in one of our series that are coming. So for the R, CIR, and then the other C has to do with something I see that is quite very, very interesting, compassion. COVID-19 has brought out the compassion in us. It has, even though there's a separatism, even though people are encouraged to lock down and lock their borders, but you could see the compassion. Unbelievable in Nigeria, the level of compassion is so high. You see corporate entities, private entities swung into action in the first week of COVID-19, coming in. You see people helping their neighbors. We have never seen this level of compassion in the history of our nation. This is some of the L. COVID-19 has shown two things. One, we need to show up our leadership, and we need to appreciate our leadership. There's absolutely no way we can address the challenges associated with COVID-19 without our leadership. So we have leadership at the top, we have leadership within the communities, we have leadership in the church, we have leadership at different levels. We have leadership in what we are doing now. This platform was created because of COVID-19. We are showing leadership in the sector by doing this. And then finally, the E, to make up the cycle, the E has to deal with empowerment. COVID-19 is actually bringing out another level of empowerment that we've never seen before in history. And this is keyed into the age that we live in now, which is the age of abundance. We are exploring information technology like we have never done before. People are becoming creative and they are becoming empowered because of COVID-19. So COVID-19 has some good parts, and the new normal, which is abnormal, COVID-19 is giving us the opportunities to make it better. We are going to take a few questions, but before we get into that question, Dr. Jefferson, you talked about treatment capacity, and you talked about the new medication, I call it Remdesivir. Can you tell us a little bit more about it? Because it gives kind of hope to know that there's something on the pipeline. I heard on the news that the FDA had to do an accelerated approval for the use of this treatment. Please, can we get your insight on that?
Absolutely. So Remdesivir is an antiviral. It's been around for a few years. It's produced by Gilead Pharmaceuticals. And it was first manufactured and first studied as a possible treatment for Ebola, actually. It did not work there several years ago. The study showed that it was not effective in, for treatment for that. Subsequently, it was used during SARS and MERS outbreaks, studied, looked at, And then they sort of abandoned the trials, mostly because those diseases sort of disappeared. So they didn't really continue to go down that road. They revived remdesivir when COVID-19 came about to see kind of what effect it would have, since they knew it had some sort of effect on other coronaviruses in the past. But the data was not very robust. So there have been trials going on. The main one is going on across the globe right now. The one that kind of led to the FDA emergency authorization is one that was done by NIAID, which is part of the NIH in the US. And it showed, they did it in about 1,000 patients. It showed that it decreased the length of illness. So from 11 days, I'm sorry, from 15 days to 11 days. And then they also showed that it decreased mortality between people who were getting the drug and people who did not receive the drug. The thing with this trial is that it was randomized, controlled, with placebo and with treatment, which means that it's a very, very well structured study. Most of the other studies of remdesivir have been what's called kind of retrospective studies, meaning they look back on information to see kind of what happened, but it wasn't in the moment that people were ill, in the moment when they needed treatment. So this is a very well-controlled study, very well done, and it really shows that it may be something that can be used in severely ill, hospitalized patients. They're not studying, or they don't have information yet on people who have more mild illness or people who
Dr. Jefferson?
Yes. Were you able to hear?
Hello, Dr. Jefferson. Can you
I
hear
can hear
us?
you, Dr. Abolo.
Yeah, we lost you at the time. Um, can you backtrack a little bit?
Absolutely. So with remdesivir, it's an antiviral, and what I was mentioning is that it the studies very well.
Can
Can you hear me, Dr. Abolo? Can you hear me? Can you hear me? Okay.
Yes, I can hear you.
You can hear me?
I can hear you.
Okay,
Yes,
good.
very well.
So the studies were very well done.
Yes, I can hear you.
Okay, great. So I'll
well. I can hear you.
Okay. So the studies were very overall, it we still have we still need to see if it makes any difference in patients who are not as severely ill, if it makes any difference in asymptomatic patients. And there's also some thought that since it's an antiviral and it blocks basically your cells from becoming infected with the virus, that if it can decrease the amount of shedding of the virus, meaning decreasing the transmissibility of it, then that also is going to be huge. So they're still studying that portion. And hopefully we'll get some data on that very soon.
Beautiful. Thank you very much. We need to take a few questions as we round up this session. This is very interesting. I wish it wouldn't stop, but let's take some questions. We can have a part 2 and a part 3 of this. So let's take the questions. First question. I think this question is for you, Dr. Jefferson. It says, are there benefits for us in herd immunity? Are there benefits? Because I recall that you talked about herd immunity and you talked about 60% or 65% of the population being infected to establish a herd immunity. So can you throw more light on that? And then, but the question is, are there benefits if we need to use that as an option to suppress COVID-19?
Right. So I think in short term, I do not think the herd immunity approach is a very good one, because what it does is it allows natural infections to happen so that you can get to that 60 to 70% immunity in a population. So it allows people to get sick. It allows people to continue to transmit the disease. It allows people to die. That's what people are doing in places like Sweden. I think from an ethics standpoint, it's not a very good way to go, because, you know, we should be protecting human lives, not kind of allowing people to succumb to this. Long term, however, there are many benefits to herd immunity. So long term, we know that it can protect against second waves, third waves, fourth waves of infectious diseases if we get a certain number of the population to be immune to the virus. So that can happen either through natural infection, which is happening now, and the other way it can happen is through vaccination, which we're still working on vaccines. So the hope is within the next, you know, somewhere between 9 to 12 months, we can have a vaccine that we can give to at least 60 to 70% of the population, thereby conferring herd immunity and decreasing the risk of second, third, fourth waves of the virus.
Beautiful. Thank you so much. We'll take 1 or 2 more questions and then we'll begin to round up. This question is from Gift Ilolo. Gift Ilolo says that the conspiracy theory linking 5G to coronavirus as the major cause of this infection. How true is this theory? Who's going to give a shot at that question? Anybody? Who's going to
I'll do
give
a short
shot?
answer. A short answer, it's not true.
It's not
And
true.
it's not true. That's that's all I have to say. I don't know, the Honorable, if you have anything further.
It's a conspiracy theory, and it's
Yeah,
not
it
true.
is a conspiracy theory. It's not true.
Absolutely. Okay, let's take 1 more question before we close this session. Another question from Gift Ilolo. Gift says, there is a herbal remedy to the cure of COVID-19 from Madagascar. Why is the World Health Organization not taking this serious? Dr. Jefferson, can you tell us about this?
So I'm actually not aware of this herbal remedy. You know, so I don't know exactly what it is, but I think that, you know, there are very well-intentioned, very smart scientists all over the globe who are looking at every possible treatment option, medication option. You know, if you look at the list of the amount of therapies that people are looking at, it's hundreds and hundreds long. So it's possible that this herbal remedy is on that list. I'm not sure exactly what it is, and that someone has looked at it and maybe perhaps deemed that it's not something with great promise, so they're not putting a lot of resources behind it. Right now, part of what we have to do is put resources behind what we think we have the best, has the best shot of doing the most work. And so, you know, we have to kind of focus ourselves in a few areas so that we can get these medications through the clinical trials to make sure they're safe, effective, and then make them available for people.
Beautiful. Thank you very much, Dr. Jefferson. Honorable Olamide, what do you have, the Abolo and all the other stuff that we use? How does this remedy, claimed remedy in Madagascar, how does it relate with our traditional beliefs and our traditional medicine, and how does it relate with the COVID-19 issue that we have on ground? What's your take?
All right, so I don't know the exact study or what the remedy is for that one they're talking about, but like I said before, there's some home remedies, Agbo, like you said, doctor, and there's something, all these things are meant to boost your immune system. You know, they are not really cure. So don't, until the FDA give us a real cure, don't follow the theories. Just do those things to boost your immune system and just to give it that, you know, that boosting in case things happen. Like I told you, and I drink everything. Like anything I see on YouTube, I drink. But is that a cure for COVID-19? No. But it's something just to boost my immune system, because I don't do this, you know, regularly until really cure, until the FDA give us something that is genuine, like the doctor said. So just don't share those theories yet.
Thank you very much. I'm sorry we may have to wrap up this session at this time. It's been such a wonderful time with these two wonderful ladies. I really want to thank you. And I will need to get you back here on the platform on the Pristine. Like I said earlier, the Pristine is an Ecologistics cloud-based conferencing platform for promoting sustainable development. What we are doing now is actually promoting sustainable development. Dr. Jefferson, all the way from San Diego, California, thank you very much, Dr. Jefferson. We'll be hearing more from you, and we look forward to when you will need to come to Nigeria, Africa, so that we can go into the trenches and do some work with the people, with the local people. Honorable Olamide is already doing that. She's sending in relief materials to Lagos, to Abuja, to reach the people. Honorable, we need you to come down too, so that we can get to the trenches together and do some work. You have done excellently well, both of you, and I really want to thank you on behalf of our team, everybody, Ecologistics and the Pristine platform. We want to say thank you, and I want to say thank you to our viewers. Please send in your questions. We are going to answer your questions, and we're going to post it on our website, www.eislco.com. And I am your host, Dr. Paul C. Abolo. Thank you very much.
Thank you.
Thank you.
Okay.